Today we're going to talk about lip augmentation. The concept of having fuller and more youthful lips is definitely not a fad, and patients ask about it all the time. Many different materials have been used to fill the lip. These include injectable materials, the patient's own fat, and even using an expendable tendon from the forearm to fill the lip. All of these methods can be used for lip augmentation, but often have drawbacks. So in comes the Permalip implants that are FDA approved for soft tissue augmentation of the face. These implants are soft, packed silicone that are shaped into tubules that are often used to augment the lips. These implants made their first national TV appearance in 2009, but have been used successfully for many years, and they have an excellent track record in patient satisfaction. These implants are soft and movable. They are silicone, but they cannot break or leak. One great thing about them is that you can have the option of removal of the implants if the patient does not desire that future lip volume and wants to go back to her original shape and form. I find that patients of two different types come to the office to request this procedure. Either they are very young and have never had full lips and have always felt that their lips are thin and desire enhancement. Or they can be a slightly older patient who is upset at the way that aging has diminished the appearance of their lips and even caused some atrophy there. Both types of patients have frequently tried lip injections such as Restylane or another product to achieve lip enhancement. They enjoy these results and they are simply looking for something that is more permanent. So hi Gina, it's nice to see you again. We're here to talk about doing some lip enhancement for you. And we had talked about this is kind of a fun little something special to do for yourself, and so I think we're both kind of excited to do it for you. The good thing about this procedure is it's very little downtime and it's very low risk. And it's fast, so it'll be over and done with before you know it. Okay, Gina, so I'm going to measure you again for your lip implant size. Once again, these lip implants come in 3 different lengths and they come in 3 different diameters. We already decided that we wanted a subtle appearance, a subtle augmentation of your lips, so it's not necessary to pick the largest diameter, and really the small diameter is almost a little too subtle in most cases. So we went kind of middle of the road, which is what typically happens. But the other very important part of this is not just selecting the diameter, it's selecting the length to limit any malposition problems. So the way we do this is we relax your lip a little bit and just open your mouth slightly. And I'm going to measure from corner to corner. And I'm kind of cheating because I already knew that you were this size, but this is nice to confirm. Right where the lip implant sits is 65 millimeters for your upper lip. And that's a common measurement. It's also common for the lower lip to be a little bit shorter, and I think that's what we predetermined for you. What we're going to do today is get you numbed up. It's going to be similar to sort of an advanced dental procedure. You're going to get some dental blocks performed that'll make a large area numb, and then we're going to add a little more additional anesthetic right along your lip border where the implant's going to rest. After we've let that set up enough time, I'm going to make very small incisions in the corner of the red part of your lip. And those are the only 2 incisions you're going to have today. I'm going to make those and then use some curved scissors to tunnel a spot for your new implant. Now the implant is going to lay underneath the mucosa, that very delicate pink soft tissue of your lip. Lay beneath that, but on top of the muscle. So it won't be underneath the muscle, but just under that layer. And that layer does provide enough bulk so that people don't see the implant when they're looking at you and talking to you. People won't feel it when you kiss them. All of those things, it'll be well covered so that nobody notices that about you. As your lip wakes up from the lidocaine and the swelling from surgery, you'll have little tingles around your lip. That's normal. You may have some brief loss of sensation from your lip. Now, our goal is not to give you a big fat lip. We just want something very subtle that is an improvement. And we not only see an improvement from this view, looking straight at you, but also from your profile. The implant where it sits will give you volume and make the pink part of your lip more obvious and a little more pouty. But with that stretch, you get the added benefit of improving some of those very fine lines that are around your lip. Because of where it sits, it pushes your lip out a little bit in profile, and so it puts a little stretch on those little wrinkles and it makes them look better. So that's another benefit. Your lip, even though you felt like it's come down some with age, it's not an excessively long lip. Sometimes we do have to do other procedures to adjust that, because simply giving someone lip volume isn't enough. If they've got a truly long lip on their face, then we need to do something else to shorten it, but that's not for you. So, good things.